It's really nice to have lots of you joining this Lunch and Learn session hosted by ARC East Midlands. Thank you very much for taking time out of your busy day to do that. So I will briefly introduce myself and then I will kind of get started with the content that I've put together for this session. So as I said, my name's Natalie Armstrong. I'm based at the University of Leicester, where I'm a Professor of Healthcare Improvement Research. My background is as a medical sociologist, and I use qualitative methods and social science theory in the work that I do. And increasingly, that work is focused on healthcare quality improvement and patient safety, and using qualitative methods and social science to kind of carry out work in that area and to think about what we can learn about problems in healthcare quality and safety, and how we might be able to implement and put in place and develop solutions or things that could make that better. And I'm also the implementation lead for ARC East Midlands, which is one of the reasons that I've been asked to do this session today. So I'm just going to share my slides and hopefully somebody can verbally tell me if that has happened.
Yes.
Super. Are they on slideshow?
Not yet. They're sort of not in presenting mode yet. They're just in edit mode sort of thing.
How's that?
Great.
Is that better? Super.
Yes, thank you.
Okay, so obviously I can't see anything now. I'm going to kind of canter through the material. Rob, if there's anything that comes up in the chat that you think needs me to stop and deal with it before we get to the end, then do please shout. But I think you'll have to shout because I won't see a hand or anything like that.
Okay.
All right. Okay, so as I said, this session is around giving you an introduction to qualitative methods. I can't think that anybody's come to a 1 hour session thinking that they would leave this knowing everything there is to know about qualitative methods, or feel that in the course of a 1 hour lunchtime session you've been sufficiently trained to go out and start doing qualitative methods. But hopefully this will either give you an introduction if you're completely new to this area, or will sort of help to build incrementally on what you already know already if you do have some familiarity with it. So what I'm really aiming for by the end of this session is that you've got that you're able to outline some of the basic principles of qualitative research, so you kind of understand what it is, what it's for, what it can do, and what it can't do. That you've got some awareness of the diversity of the methods that can be used, that you can just talk about or understand some of the different qualitative approaches, particularly around study design and data collection. And that you can have some understanding of the challenges that might be involved in collecting and analysing qualitative data. So that's what I'm aiming to cover. This is a session that I would normally do, or we would normally do, in about 3 hours as part of our MRes in applied health research. So I've had to condense it, and I'm happy to kind of give any more detail in questions, comments at the end if that would be helpful to people. So I'm going to talk to you about what qualitative research is, some of the nature and the features, give you some examples, and then, as I said, we'll move to sort of any questions and discussion. So if we start by thinking about what qualitative research is, there's a couple of extracts here from different qualitative methods textbooks, and I've put the all of the references that I'm using, I'll be on a slide at the end. So if we start with the one from Strauss and Corbin at the top, this is focusing on thinking about qualitative research as any kind of research that produces findings not arrived at by means of statistical procedures or other means of quantification. And in some ways, that's quite a kind of deficit model, if you like. It's sort of telling you what it's not necessarily rather than what it is. But it's nonetheless helpful in kind of starting to draw some of those distinctions between quantitative and qualitative. The second extract from Morse is talking about qualitative being an approach that helps to explore health and illness as they're perceived by people themselves rather than from the researcher's perspective. So this is starting to get us to thinking about the way in which qualitative methods are typically more inductive in nature, that they try and limit the kind of preconceptions or preconceived ideas that researchers might have, and the sense that it's much more open to hearing from people about their own experiences. This is another kind of offering in terms of thinking about what qualitative research is, and this comes from Tracy. And in the first chunk, it's thinking about the kind of ways that we can learn about social phenomena. So it's around asking questions, listening to stories, perhaps watching people, seeing what they do. It might be participating in various kinds of interactions like meetings. You might kind of get messages from people. You might listen to gossip. You might gossip with people. You might have those kind of informal conversations and engage in various forms of dialogue. And it's through doing all of those things that we can start to think about gathering data, qualitative data about social phenomena of one sort or another. But then the point that Tracy makes is then that it's the focused study of research methods that takes these kind of everyday interactions one step further to give them that kind of systematic framing that leads you to then be able to analyse that data for the benefit of developing those deeper understandings. Not just for us as researchers, but then because we want to try and use what we've learned to have impact of one sort or another. So Tracy kind of continues in this vein and talks about how qualitative researchers will begin the research process by identifying a particular issue or problem or dilemma kind of in the world, and then proceed to systematically both gather and interpret data in order to provide an analysis that helps to shed light on the issue, and or that can open up paths for possible social transformation and potential positive impact based on what's been learned. So there are some things that qualitative research can be particularly good at. So it's really suitable for exploring meaning, really understanding what how people understand something, whether it's a particular health condition, experience of a particular healthcare pathway or intervention, whether it's the meaning people kind of give to doing healthcare quality improvement work, but a focus on kind of exploring meaning and seeking to understand human experience of whatever it is you're interested in. And it can also be really helpful for analysing processes and trying to understand causal mechanisms. So as I said when I introduced myself, a lot of the work that we do in my research group at Leicester is around healthcare quality improvement, and a lot of that involves us doing qualitative process evaluations of various efforts to improve quality and safety of healthcare in one way or another, and really trying to understand what the process of implementation has looked like, what's gone well, what hasn't gone so well, if something's worked, what's made it work, and if it doesn't seem to have worked, what might be underpinning that. So qualitative research can be suitable for all of those kinds of things. And if it's well conducted, then it can offer that more in-depth, nuanced information that quantitative can't really deliver. It can offer different ways of understanding things. And one of the things that's quite distinctive about qualitative research is the way that it can potentially kind of take different lenses or different perspectives on a particular issue or a particular problem. So it can really help to open up things and to understand them in a bit more detail. And as I said, it can help to understand processes, and that can be sometimes really quite a helpful complement to more quantitative association-based research. And you'll very often see qualitative research work packages as part of clinical trials or other interventional projects, for example. But I caveat all of that, of course, by saying that if it's well conducted, it can do those things. And you can, of course, do qualitative work quite badly in a way that doesn't really deliver any of those things. So it has to be well conducted if it's going to deliver on those things for you. I think sometimes it can be helpful to think about what qualitative can deliver compared to quantitative. I know there are some people that don't really appreciate this kind of juxtaposition and feel that in some ways qualitative research is being asked to sort of account for itself or justify itself compared to the gold standard of quantitative, which isn't at all what I mean. But I think sometimes it can be quite helpful to look at the two next to each other to really understand the points of difference and to think about what the relative pros and cons of each are. So compared to quantitative research, qualitative typically has less tightly specified research questions. So often qualitative research will have areas of focus or things that it would like to find out about rather than having specific hypotheses that it's testing. Qualitative research really is not in the business of testing hypotheses. That's a whole different methodological approach and kind of study design. It typically also will involve kind of less work prior to data collection. So you don't necessarily do such a comprehensive exercise of it absolutely specifying all of your data collection, validating, preparing all sorts of data collection instruments. But typically it will involve more work after the data collection in terms of the analysis, which is often much more time intensive and labour intensive process. And I'll say a bit more about that later on. It typically involves much smaller sample sizes, and sometimes people who are more used to quantitative work can really struggle with getting their heads around that. And it can collect a much broader range of data. So there are various ways in which you can collect qualitative data, and there are some examples on the slide there, and I'll come back to some of those in a bit more detail later on. But often in qualitative work, you're combining different kinds of data to, as I said earlier, to kind of do that work of thinking holistically around a problem. And finally, it will typically produce findings that are lengthier, richer, perhaps less definitive and more context dependent than quantitative research. One of the things that I always find when I'm doing kind of mixed methods research is when you have draft papers on the basis of qualitative findings, which can run to kind of 8,000 to 9,000 words, that some of the people who are perhaps more clinical or more used to quantitative papers that are often much shorter, they're quite often surprised about just how much you can say on the basis of qualitative data. And it's worth saying, I think, the kind of biomedical research, a lot of health services research, and also quantitative social science is often concerned with seeking to measure variables objectively and to analyse them statistically. But what's useful about kind of social science and some of the things that qualitative work might be interested in working with is that sometimes there's only so far that quantitative understanding can take you. So, for example, we might think about things like patient satisfaction, social support, quality of life. There are ways, of course, that you can measure those quantitatively. You can use questionnaire scales or numerical scores of one sort or another. But there are other ways that you can learn different things and more things around some of those issues by using qualitative methods, either instead of quantitative scales or alongside them. So this is just to give an example of that. So say you wanted to learn about someone's quality of life based on their experience of a particular health condition. One way in which you could do this is to use something like one of the kind of numerical scores or scales on the left, which you might recognise, which gives people a set of questions, very kind of tightly defined. They have a limited number of options, and then once they've completed it, the scores are amalgamated, and there's a kind of complex scoring algorithm that goes on in the background to produce a kind of numerical result. And that can be fine. That can be exactly the kind of data that you want, depending on what you want to use it for. But another approach is to do something more like on the right, which is to sit down with someone, to talk to them, to really understand from them what their experiences are, to ask them quite open questions, and to really get more nuance and more detail about how a condition might be affecting them and how it might be impacting on their quality of life. So if we think about what some of the defining features of qualitative research are, I think there are probably three that I think it's helpful to highlight. So one is around the importance of context. So one of the things that is possible through that more detailed engagement is that you can really start to understand perhaps how people have come to think about certain things in the way they do, why they might have the beliefs or the values that they do, why they might behave in the ways that they do. And that broad context can be really helpful in really developing those more nuanced understandings that qualitative research can offer. And I think qualitative research is about embracing that context and seeking to use it as a positive part of the research rather than trying to kind of control for it or bracket it out as some other study designs might do. And the visual here is really just a quite basic example to make the point that, you know, depending on the context, depending on your perspective, depending on the kind of lens through which you look at something, can impact sometimes quite markedly on what you understand the thing to be, how you orient to it, how you might behave in relation to it, which, as I said, are some of the things that qualitative research can be really good at trying to find out more about. The next thing is around what's often called thick description. And what's meant by this within the qualitative methods literature is that if you're going to collect that really rich, nuanced qualitative data, the analysis that you do with that and the kind of output of that, if you like, ideally is as sophisticated and nuanced and provides, as I said, what's often called that kind of really thick description, that you get a really, really good nuanced understanding of whatever it is your research has been about. Now, I use this picture in all sorts of ways in my presentations because I just like it. I've no idea what it means. I don't know what any of these levers or pipes or anything are, but what I like is the way that it shows the kind of interconnections and the complexities, and the point that, you know, something might happen over on the right-hand side that then might impact what happens on the left-hand side, or something might complicate something else or block something else, or something's got to be in place before something else can happen. And I think that's quite a helpful way of kind of thinking about this idea of thick description, that it really starts to help you understand what's going on here, how are things interrelated, what are some of the potential synergies or tensions or complexities in terms of what I'm hearing from different people and from different perspectives. And I said a moment or two ago that qualitative research, if it's done well, can deliver those things. There is some qualitative research that really does produce only quite thin descriptions, really just a basic synthesized account of what people have told you, rather than necessarily deep analysis and deep immersion in that data to work out what it might all then mean. And then the final feature is around reflexivity. So this is around how the field of study is filtered through the interpretive lens of the researcher. And it's really an acknowledgement, as it says on the slide here, that just by being there, the researcher may well have an impact on the phenomena. And that might be in terms of what people will and won't talk to you about, or how they'll talk to you about it, or it might influence how you understand what they're telling you. If you're doing observations, it might influence kind of what you see and what you don't see, but a real recognition that may well happen. And what reflexivity is about recognizing that and surfacing that, but not necessarily trying to bracket it out and make it go away and not be a problem. It's about recognizing that will happen, and actually sometimes can be beneficial. So in terms of advantages and disadvantages then, you know, often these things go together, don't they? So one of the advantages, of course, is that it can produce really rich data. That inevitably takes time to generate and to analyse appropriately. It can be very good at giving participants voice. It can also face kind of challenges about being too subjective. It can offer really rich descriptions of specific contexts. The flip side of that might be that its wider application might be more limited. And it can open up new concepts in areas not anticipated. So I said a little bit earlier that it's often about not taking the researcher's preconceived ideas into it. So it can open up all sorts of interesting new avenues that the researchers might not have thought about. But the flip side of that, again, is that it doesn't always answer the intended research question as expected. And that may or may not be a problem, depending on the nature of the project, the time, the resource you've got to potentially explore some of these unexpected issues. One of the things that we quite often realise when we're doing our qualitative work is that often you can come to understand that you're asking the wrong question. And one of the really nice things about qualitative research, I think, is that it does give you the flexibility to adapt and iterate and respond to that kind of learning almost in real time as you're doing the research. Okay, so I'm going to move on now to talk about some specific qualitative data collection approaches that can be used. I can't possibly hope to cover all these in the kind of detail that you might want, so it's going to be a bit of a whistle-stop tour. But qualitative fieldwork and data collection can take lots of different forms and can involve collecting all sorts of data. And here are some examples. Some of them you might already be familiar with, some of them might be a bit more new to you. But on the left-hand side there, you can see there are things like semi-structured interviews or much more in-depth, less structured interviews and things like focus groups. They're obviously very commonly used. In the middle, there's sort of talk about ethnography around working with naturally occurring talk, and that might be things like recordings of various healthcare consultations. You can do observations in various settings, either as a participant or as a non-participant. And then over on the right-hand side, there are various other forms of data that could potentially be useful to qualitative studies. So, for example, you might work with various textual resources. They might be diaries, either that people have kept and are willing to share, or that you ask them to collect exactly for your research. You might look at various kind of online textual sources like blogs or forums or those kinds of things. You might look at media. That might be media coverage of a particular health issue, for example. That might be via TV or newspapers or, again, social media. You might use various documents of one sort or another that are connected to the health topic or healthcare topic that you're interested in. Or you might be interested in kind of other kinds of artifacts. So there are methods, for example, that involve asking people to take photographs of things that are important to them that relate to the topic you're interested in. Sometimes if people are doing research with children, you might see that they ask the children to draw pictures that they then talk about with them. So there are all sorts of ways that you can get qualitative data to work with. And if we kind of start from that position that qualitative researchers ideally study things in fairly natural settings rather than kind of interventional RCT type settings, to make sense of or interpret them in the way that is meaningful to the people that bring them. I think that starts us to think about some of the distinctions between the various types of data that we can use for qualitative research. So you might have been wondering why I put these in these 3 bullet point lists. And it's so I could do this, which is to start to make that distinction between the different kind of natures, if you like, of some of this qualitative data collection. So on the left-hand side, kind of things like interviews and focus groups, arguably you can think of those as quite interventional research in terms of qualitative data. It's data that wouldn't exist if you were not creating those opportunities or those means of collecting the data for your research. And as I'll go on to talk about more in a minute or two, there are people who would question the usefulness of that kind of qualitative data. In the middle, there's what you might think of as more naturally occurring data. So that might be, as I said, spending time kind of immersed in a particular context to learn more about it. It might be working with audio and or video recordings of things like healthcare consultations that would have been happening regardless of whether or not you were interested in researching them. Or it might be that you spend time sort of observing in various healthcare contexts. And arguably that's more naturally occurring data, but there might still be questions about would it have happened in exactly the way it's happened if you weren't there watching it and potentially influencing it to some extent or other. And then on the right hand side again, a lot of these perhaps are data that might be considered quite naturally occurring. Certainly if you're going to something like an online forum and just observing what's been written and what's been talked about there. But you have to bear in mind, of course, that some of that might be quite carefully presented for one reason or another. I'm going to go on and say a little bit more about in-depth interviews and ethnography, and just briefly a little bit about documents, but not too much. So probably some of the most frequently used forms of data in healthcare related qualitative research are these kinds of things. So in-depth interviews where you might talk one-to-one with a patient or a clinician or a manager or whoever it might be that's relevant to your research to find out what they think about something, what they do, why they do it in the way that they do it. Observation or ethnographic observation can involve observations of healthcare processes in practice. That might be over a shorter or a longer period of time. In terms of what's often just called kind of just hanging around in settings and trying to see what they're really like and who's important and who's there and what happens and what doesn't happen. And sometimes documents are also used as well. That might be all sorts of things that you can collect. But for example, in the kind of work that we do in our research group at Leicester, we might use things like minutes and agendas of various meetings. We might use quality improvement project reports or plans or training materials, those kinds of things. And they can provide really important insights into groups and organisations and institutions. But as I said, one of the things that you have to think really carefully about documents is, why they've been written and structured and presented in the way that they have. So, for example, if you think about minutes of a meeting, they can be really helpful in terms of getting a sense of what has and hasn't been talked about. But you absolutely have to bear in mind that there might have been quite a process behind the scenes to draft and polish and perfect those meeting minutes in a way that people can feel comfortable with. You've probably done the same as I have. Sometimes you're in a meeting and it's quite complicated and heated and things are talked about in quite a lot of detail. And then you might get the meeting minutes through and it's quite a sanitized version of what's been said. Is someone asking a question? Sorry, I can't hear. Yeah. Or does someone need to mute themselves?
I think we've just got a bit of background
noise.
I think.
Okay, I shall push on then. Okay.
Yeah. Muted, Natalie.
All right, super. Thank you. Okay, so in-depth interviews, just to say a little bit more about these. So interviews are more or less structured conversations between a researcher and a research participant. They'll typically follow a topic guide. Sometimes it's called an interview schedule, but absolutely with the ability to stray beyond that into related areas of interest as they are produced and made relevant by the participant. They're usually audio recorded. You need someone's consent to do that, of course, and they can take perhaps 45 to 60 minutes on average, but they can be much longer and they can be much shorter. And sometimes that's kind of driven by the complexity of the topic. Sometimes it's just how much time you can get with somebody. So they can be really quite variable. And I think it's really important that it's not necessarily the case that the longer the interview, the better quality of the data. But interviewing for qualitative research is not necessarily straightforward. It's a skill that's learned with practice. You can obviously do training of one sort or another, but you also learn an awful lot just by doing it and reflecting and thinking about what has and hasn't worked. And they're really different from other kinds of what might seem quite similar things. So they're obviously very different to something like a job interview. They're also different to taking a patient history if you're a clinician. And it's really about the art of the skillful interviewer being able to elicit relevant information without leading the participant. It's about having the ability to build rapport with somebody quickly, to be able to listen really actively to what someone's telling you, but also hear what they're not saying, to be able to prompt and probe neutrally, but to get more detailed information, to ask neutral and open questions, but also to sometimes just sit strategically with silence for a little while and see if somebody has more that they're willing and able to say. So when we do this session with our students, we sort of spend a bit of time thinking about these questions and what might be wrong with them. So I'm not going to sort of pause and do group work here, but these are just some kind of quite basic examples of things that you have to be careful to avoid. So the first one, and these are all sort of in the context of doing some qualitative work around a quality improvement project in healthcare. So the first one, did you sign up to this project because quality of care is poorer here than in any borough? And what you can hopefully sort of see quite quickly is, the researcher might be interested in finding out why people wanted to be part of this quality improvement project, but it's really important not to start to put words in their mouth about what may or may not have been relevant to them here. So asking a much more neutral question around, so can you tell me why this project was of interest to you? The second one, can you tell me why you decided to join up, whether you think it will be effective or not, and what you personally hope to get from it? That's a lot of questions all bundled up into one, and there might be all sorts of things that the participant is willing or able to tell you about any part of those, but you need to kind of break them down into those more focused questions that you can go through kind of incrementally and really start to build that understanding. The third one, what's the most challenging thing about this project? And sometimes people don't really think this is too problematic, but I think from my perspective, you're assuming that there has been challenges in the project, and that may or may not have been the case. So you could just rephrase that quite simply to say, have there been any challenges? But sometimes if you say what's been the most challenging thing, a participant might think that they've got to have something to offer you, even if they haven't actually found anything that challenging. And then the final one is around how have you found getting older surgeons on board? And I think it's very often the case when we're doing our research around quality improvement that sometimes there are particular groups of healthcare professionals or patients who are more difficult to engage than others. But I think, again, it's about starting from a much more neutral position and saying something like, are there any particular groups that you found it more difficult to engage, rather than, as I said, sort of starting to come in with pre-assumptions and to be putting words in people's mouths about what they may or may not have experienced. So this is just an example from what an interview extract might look like. So you can kind of see it's that very neutral questioning. Can you see any other problems? The participant kind of gives you a bit of an answer, sort of checks to see that it's kind of the right thing that you're interested in and that you understand, and the interviewer kind of says yeah, and signals that they can go on if they would like to. And then the participant gives you a bit more, and then the interviewer sort of starts to probe that a little bit and sort of tries to think about, okay, well, why do you think it is that that's happening? So that's just a very simple example of what a qualitative interview can look like. And you can do interviews in various ways. In the literature, there are lots of examples. There are various variations, including something called narrative interviewing, which, as the name suggests, is often focused on encouraging people to tell you their story. And sometimes that they will literally start the interview with saying, just tell me your story, and then just listening to whatever it is the participant has to say. You can do interviews that have more than one interviewer or more than one participant. And then obviously, once you get up to a certain size, you're thinking of something more like a focus group. But it is possible to be critical of interviews, or at least to think really carefully about the kind of data that they give you. So they can be seen as quite superficial, particularly if you haven't probed or kind of prompted enough to really understand what someone's saying. They can be quite partial. People can only tell you what it is they know about or what they think about it. And at some level, interviews can only ever be accounts. So if it's about what people think or why they think that, then that's arguably not too much of a problem. If it's around what people do, then somebody's verbal account of what they do may or may not look like what actually happens in practice. And that's not necessarily because they are seeking to deceive you, but sometimes people just don't have the ability to necessarily really reflect on what they do. So they might tell you what they think they do, but if you observe them, you might see something that looks a bit different. Which brings us on to ethnography, which is the study of practices and culture of a social unit through direct contact as a participant or as an observer. And it's often talked about as being grounded in that commitment to a first-hand experience and exploration of a particular social and cultural setting. And data are collected through things like observation, more or less formal interviews, and sometimes they really will just be quite informal chats that you have with somebody. Collecting of documents that are relevant in that setting in one way or another, and experiencing a place or a context firsthand. Ethnography can involve spending weeks or months or even years sometimes, what's called in the field, although it's much more common within healthcare to use ethnographic techniques that are increasingly being developed to be done over much shorter periods. That's quite commonly used in healthcare. And researchers will typically keep kind of field notes as they do the observations kind of in a notebook. They might make some use of audio recordings or even sometimes video recordings with consent. And the objective really, as I said, is to get that understanding of a setting in its full richness and complexity. So revealing things like taken for granted routines that nobody thinks to talk to you about because they just don't sort of feature consciously and intentionally. Norms, relationships, all of those things that people might not necessarily recognise and think are relevant to talk to you about if you did an interview. And you might do observation work within a ward or a clinic or a consultation or various places. And it claims to offer a sort of systematic, comprehensive understanding that's not available through other methods. It rarely uses very structured data collection instruments. So if you're just having kind of informal chats with people in the course of your ethnographic observation, you're probably not even going to use a topic guide to do that. And it will have a focus, but there will be perhaps things that you are particularly interested in looking for. And sometimes in the literature, you'll hear those talked about as foreshadowed problems or sensitizing concepts. What's generally the case is that the person doing the research will be what's called a non-participant ethnographer. So they won't be part of the team that's doing whatever it is that gets done. They'll be a non-participant observer. And it's about trying to combine the insights that perspective can bring with some of the experience of being on the inside and getting a feel for how this is in practice. It involves gaining trust. You've both got to kind of get into these settings, but you've also kind of got to be accepted when you're there. It can involve kind of hanging around in the right places or what you hope is the right places, asking really stupid questions about things that no one else seems to be unsure about, but are not at all clear to you. Sometimes about being part of the backstage conversation. So, for example, hearing what a clinical team are saying, and planning for a consultation or an MDT meeting before the thing actually happens. But really importantly, sometimes it's about knowing when you should just withdraw from a particular situation. That can be really important for ethical reasons. So this is just an example of what some field notes might look like, just to give you a sense. So this is from a study by Featherstone et al., which was NIHR funded, which was looking at continence care for people with dementia in hospital. And this is really just an example of, a quite mundane thing that the researcher observed while they were spending time on a hospital ward, but making the point that, okay, I noticed this, and this is what I sort of thought about it as a result. So it's talking about water bottles and that they're not accessible because of where they've been positioned, and kind of thinking through, well, okay, what would a patient actually have to do to access it? And it would be the patient has to leave their bed, which they may or may not be able to do, or they would have to ask for assistance, and that may or may not be forthcoming in a timely way. So ethnography can be really time consuming to do. Note-taking can be quite difficult. If you're in a really busy, complex, high-pressure setting and you're trying to take notes as things are going on around you in a notebook, that can be quite difficult. Sometimes it can be quite ethically challenging. Sometimes, as I said, you have to make really quick decisions about, is it appropriate for me to be here and to be seeing this? You can have to find that balance between an in-depth focus and a broader understanding. And that kind of inside or outsider perspective and dynamic can be quite difficult to manage, certainly if you are in a setting for an extended period of time. And there's a balance between being familiar enough to understand a culture or a setting and guarding against what's called in the literature kind of going native, the idea that you become such a part of it that you lose that criticality and that distance, and that's something that has to be quite carefully maintained. I'm not going to say very much about analysing qualitative data, other than to say there are many approaches to analysing qualitative data. Any good methods textbook will talk you through some of these. These vary in focus, so sometimes the focus is about what is said, sometimes it's about how is it said, sometimes it might be around the stories that are told. So there are all sorts of ways that you can work with qualitative data, but mostly they will involve reading and rereading in a lot of detail transcripts of one sort or another. So they might be transcripts of interviews, field notes from observations, a transcript of a consultation, identifying units of meaning, coding those accordingly, and looking for patterns across individuals and groups or different care settings. So really trying to understand what is in the data that can be drawn out of it. It can be very labour intensive. It mostly is very labour intensive to do. And often it will involve the use of specialist software, of which there are lots of examples, but I've just given one there which we use, which is NVivo. A slightly less demanding approach is what's called framework analysis, and this is quite often used for very practice or policy focused research. And this takes certain shortcuts in a way, and I don't necessarily mean that in a negative way, to the way that those initial codes are identified in order to kind of speed up the process. And it uses tabulation as a way of assisting in the analysis process. It's got a multi-step method that is more protocolized than most other qualitative analysis approaches. It can make it quicker and arguably more efficient to do, but the downside might be that there's loss of insight from some of the more inductive approaches. And again, there's an example there of literature that you can look at if that's something that's of interest to you. What I'm just going to do in a couple of slides now at the end, and I'm conscious I have been talking for quite a long time now, is to just give you a very brief example of a piece of qualitative research which I led that we've just recently finished, just to give you a sense of how you turn kind of aims and objectives into data collection. So this was a study called Optiprem. It was NIHR funded, and it was looking at place of care for babies born at 27 to 31 weeks of gestation. And the study was a large mixed methods study, and it was centred around the problem, certainly at the time we did the research, that for this particular group of babies, there wasn't clear evidence or clear guidance as to whether they should receive care after birth in a level 3 neonatal intensive care unit or in a level 2 local neonatal unit. For babies at other gestational ages, it was much clearer what level of unit they should be cared for in. So we did this research in this area, and the aim for the qualitative work stream, which I led, was to understand how decisions about place of care are made, and about parent and clinician perspectives on place of care. And we broke that down into a set of sort of more tangible questions, if you like. So one was around how decisions about place of care are actually made in practice. One was about what parents thought should guide that decision making. A third one was around what clinicians' perspectives and practices were around decision making about place of care. Fourth one was around how place of care and any change in that impacts on families. And then finally, to think about how parents could be best supported at that time. So what we did was to collect some different forms of data, and to do that in different ways to try and bring together a set of data that could answer those questions. So we did some ethnographic observations in 6 neonatal units across 2 neonatal networks. And that involved, as I've said, sort of spending time observing in those settings, really seeing what's happening, seeing the interactions that go on, seeing how decisions are made, making notes and then discussing those as a team. We also did, as well as the kind of informal chats during the observations, we also did some formal interviews with staff that we recruited from those units, to try and really help us understand some of the things that we'd seen. We did 2 sets of interviews with parents. So we did what we called real-time interviews with parents, and they were parents that we recruited because they had children in the units on the at the times we were observing. So we were interviewing them sort of in real time, if you like, while they were still in that experience of having a baby receive neonatal care. But we also wanted to do some what we called retrospective interviews. So some interviews with parents who had been in that position, but were now not, and were able to kind of look back on it with the benefit of hindsight. And some of those we recruited from the units in terms of going through units records, but most of them we contacted via some work that we did collaboratively with Bliss, the baby charity. So we have different kinds of data that we could bring together. And just on the bottom of the slide there, what I've done is kind of put just a list of the things that we've published, in case you want to have a look and just really get a sense of what this qualitative work has looked like in practice. The one at the bottom is the protocol for the wider study. So if you're interested in seeing how the qualitative element fitted in to the broader study, then that would be helpful. And then the 3 above that are various qualitative papers addressing different aspects of our questions and using different kinds of our data in order to do that. These are just some of the things that I have talked about as we've gone through. As I said, there is no shortage of qualitative methods textbooks around. I think often it's kind of finding one that works for you, that you're comfortable with. I think if you're particularly focused on health research, it can be quite helpful to look at a book that's specifically around qualitative health research. That's just my personal perspective. So I will stop there. I'm very happy in the time we've got left to take any comments or to answer any questions. So I'm going to attempt to stop sharing.
Thanks, Natalie. That was really clear and excellent. I think you called it a canter through qualitative research, but certainly for someone like myself who's just starting out in qualitative research, I found it really, really helpful. And I particularly liked your slide where you identified, you know, like interviews being like an interventional form of qualitative research to the sort of more naturalistic. I'd not sort of thought about it in that way before. I think we've got a couple of questions in the chat. Rob, can you see?
Hi, yes, we've got a question here from Steffi, and it says, can I ask how accepted is pluralist analysis in a piece of IPA nursing research? I'm considering using IPA, Braun and Clark's thematic analysis together as a more rigorous analysis process?
Yes, absolutely. So I think you will quite often find different kinds of analysis approach being combined because it's felt that they add value and can do more than either approach might take on its own. So it's absolutely acceptable to do that. I think what's really important with all of these things, whether you're combining different modes of data collection or different modes of data analysis, is that you are able to really clearly articulate why you're doing that and what the value of it is. And I think if you've got a reasonable justification for doing that, then I think that's, from my perspective, that's absolutely fine. I hope that's some help. Any more, Rob?
Thanks, Natalie.
No more in the chat, but we've had a couple of responses saying thank you and how useful the presentation's been.
Good, Natalie, I'm pleased about that. Thank you. Yeah.
Oh, we have another.
I just ask, have you got any tips about where to start with reflexivity?
Well, I think that's a really good question. I think the obvious place to start is recognizing that it's important. That's one of the most important things. I think then what you can do, and what I will encourage either my researchers to do or my students to do, is to think about it at a really, really early stage. So when you're planning the research before you've even started collecting any data. So it's thinking about, who am I, what's my identity, and how may that sort of be influential in the work that I'm planning. And sometimes that might be because you are a particular kind of healthcare professional and have various insights into the subject area that you're going to be researching. It might be that there are particular factors of your own identity, like your gender or your ethnicity or your socioeconomic background, all sorts of things that might influence both how you see a topic and think about a topic, but also that might impact on how your participants will view you and engage with you. So that's really important to do beforehand, and to think about whether there are things that you need to do to address some of those things. That might be sort of being explicit about some of them in a participant information sheet, for example. But then what's also really important is that you kind of keep doing that reflexivity through the research. So when you're reflecting on how a particular interview has gone, for example, you are thinking to yourself, I wonder if they would have said something differently to somebody else. And definitely sort of when you're coming out the other end of it, when you're writing up either your project or you're writing up papers, that you think, okay, what do I think I've learned now, having gone through that process? What did seem relevant or not relevant? And there might have been things that you were worried about that actually didn't really seem to be a problem at all. But it's kind of closing that loop. I think that's really helpful. But it takes time. I will very often, and lots of methods textbooks will say this, really encourage people to keep sort of a research diary to capture these things as they're happening.
Thank you. That's really helpful.
Hi, we've got some really nice questions coming in now, really interesting. So the first one is, are there any particular software or resources that can support with data analysis and data collection, i.e. transcribing?
So I'll take the last one first, which is around data collection, software for transcribing. So there are various bits of software that make various promises that they will transcribe your data beautifully for you. And sometimes if you're recording in Teams, for example, it will produce a transcript of sorts for you. I think we've looked at a few of them in our group. I think we've yet to find one that does it to a really high standard first time. So we do still pay to have people transcribe our things for us. depends what kind of resource you've got available to you. Perhaps, you know, an auto transcription through Teams or something like that might be better than nothing, or at least you can kind of work with it to edit it. There are all sorts of particular software that you can use to support with data analysis. So I mentioned one which is NVivo. There are all sorts of other ones that you can use, and I can try and dig out a web link to an organisation that I'm struggling to remember exactly now, but there is a group that specifically looks at kind of computer assisted qualitative data analysis. I can dig out a link and ask the team to send it on to you. I think one of the things that's really important, though, to make the point is that qualitative analysis, using that kind of software can be helpful, but I'm a bit of a dinosaur and I still have the view that it's not going to do the thinking for you. It can help you to organise and keep track of things, and you can use it to write memos to yourself as a kind of iterative way of working with your data. But it's not going to be like SPSS where you tell it what to do and press a button and it's going to do it for you.
Thank you. We have another question here. As a PhD student, can I use a mix of qualitative methods together, such as focus groups, interviews, and ethnography, and specifically in a limited time?
Potentially. I think an awful lot depends on how much time. I think I would encourage you to be careful about, I think one of the risks is if you try and do too much in the time that you've got available, you potentially don't do any of it well enough. So in theory, you could, and definitely there's no issue with combining those different kinds of data collection methods together. But again, I think it comes back to the context, and it comes back to really how much time do you actually have, and might it be better to focus on doing one of those things well than trying to do too much.
Thank you, Natalie. We have another question here. I think we're getting towards the end of our time, but if you don't mind answering, that would be great.
No, you're fine.
So it's, what advice would you give for building rapport and trust, etc., where due to local ongoing safety issues or not permitting travel, data collection from focus groups or interviews is needed to be online rather than face to face? So the sort of virtual rather than...
Yeah, I think that's a really, really good question. And certainly, you know, from the pandemic onwards, we've seen an awful lot of qualitative data collection kind of move online, or doing phone interviews or that sort of thing. And I think it can be difficult to build rapport in that way. So sometimes, you know, a kind of preliminary conversation can be helpful before you actually sort of do the data collection activity. But I think one of the things that is being increasingly shown in the methods literature is that there are times actually when people can actually feel much more comfortable doing things online or by phone, because they feel a bit less exposed, a bit less vulnerable. So I think it's really kind of swings and roundabouts, really. But I think if you are going to have to try and build that rapport really quickly, I think in some ways, whether you're doing it online or in person doesn't necessarily make a huge amount of difference. I think one of the really key things is about making sure that your participant, if it's a one-to-one interview, or a group, if it's a focus group, that you are making them kind of feel safe, that they understand very clearly kind of what the ground rules will be, how you will and won't use the data. Obviously, you do a lot of this through the written information that you give them beforehand, but making sure that you make people feel as comfortable as you possibly can, so that they will be able to contribute in the way that sort of feels safe to them.
Thank you. We're getting a lot of people saying thank you very much for all the valuable advice and for a brilliant session. I know we're on time now, so if we haven't got any more questions at the moment.
Okay,
other than,
fine.
will the recording be available? And yes, it will. Is this the answer?
Yes, it will. Yes, absolutely. That's one of the reasons that these are all being recorded, isn't it? So that we can make them available for people that couldn't attend in person. Okay, well, thank you all very much for listening and for your questions and for your kind feedback. I'm not sure when the session will be made available, but I know it will be at some point, won't it, Eleanor, on the YouTube channel?
Yeah, we've recorded it, so yeah, I'll ask Patricia to sort it so it's available as soon as possible. But I know she's away at a conference, so it might not be till early next week. But that was excellent. Thank you, Natalie.
No, you're very welcome. Thanks everybody for coming. And do obviously look out for the rest of the Lunch and Learn sessions. There's a whole series of them that are planned. So yeah, please do keep joining them and recommending them to other people. But yeah, thank you very much for your time this afternoon. I've really enjoyed it.
Thank you.
Thank you.
All right, thank you. Bye-bye.
Thank you.